Hi everyone, my name is Dr. Mumbi and I'm going to be presenting to you on hyponatremia in the acute care setting. This is one of the common conditions that most patients tend to come with. Hyponatremia is a condition in which there's a low sodium level in the serum, or rather in the blood levels. The normal level is 135 to 145 millimoles per liter, and we can split it up into three categories. The first one being mild hyponatremia, which usually occurs when the sodium level is between 130 to 134. Moderate hyponatremia can be considered symptoms that present usually when the sodium level is between 125 to 129, and then profound or severe hyponatremia is usually sodium level less than 125. Causes of hyponatremia. Hyponatremia occurs when too much water dilutes the sodium in the body, causing cells to swell. Most common causes include medications, for example, diuretics, certain antidepressants, and certain pain medications. And then medical conditions, these include CHF, renal failure or kidney failure, liver cirrhosis, and then conditions where there's hormonal imbalances, especially conditions where there's excess amounts of antidiuretic hormone, which causes the kidneys to retain excess water. And not usually, this is a condition known as syndrome of inappropriate antidiuretic hormone. And then in cases of dehydration related to excess fluid, and then sodium loss through vomiting, diarrhea, or heavy sweating, and also increased, like we said, antidiuretic hormone levels. Then excess water intake, like in the case of somebody running a marathon or exercising and end up taking too much fluids which don't contain electrolytes. Then recreational drugs like ecstasy, which is an amphetamine, which increases the risk of severe hyponatremia. Then symptoms of hyponatremia include nausea, vomiting, headache, confusion, loss of energy, drowsiness and fatigue, restlessness and irritability, muscle weakness, spasms or cramps, seizures, and sometimes even coma. The brain is particularly sensitive to the fluid imbalances caused by low sodium levels. And then overt neurologic symptoms most often are due to very low sodium levels, usually less than 115, resulting in intracerebral osmotic fluid shifts and unfortunately brain edema. Management. Treatment depends on the cause and also the severity of the hyponatremia. And there are some cases where the hyponatremia can be chronic, and then cases where it is acute. So depending on the cause, depending on the underlying sodium levels over a period of time, that will determine the treatment that the patient will receive. Management may involve restricting fluid intake, adjusting medications, or administering intravenous fluids. And then again, to determine what sort of fluids to give, whether it's hypertonic or just hypotonic, depending on the fluid that you need to give. It all depends on the presenting symptoms and then the cause of the hyponatremia and the severity. For severe cases, care for sodium correction is necessary, which is sometimes best managed in the intensive care unit under the supervision of a nephrologist or an internist. That's it for today. This is just a brief presentation, just a rough idea on the management and the possible causes of hyponatremia. Thank you. Looking forward to our next presentation. If you want to read more about hyponatremia, there are a few resources I used, like this one, Diagnosis and Management of Hyponatremia by Adrogi, Turka, and Madias. And then Adaptation of Brain to Hyponatremia and its Clinical Indications by Gankan, 2023, and then Staines, 2018, Treatment of Severe Hyponatremia. Thank you so much.